my pleasure now to welcome Dr. Francis Collins, former director of the National Institutes of Health, former head of the Human Genome Research Project, and esteemed geneticist. Hi, Dr. Collins. Good to see you. All right, well, we began with the elephant in the room for Dr. Dobbs, and now I'm going to give you your elephant in the room. I know you're a federal employee. Yes. We don't want to get you fired, but we did just hear Mayor Bloomberg say that it would be beyond dangerous to have Robert F. Kennedy Jr. as health secretary. And I know you can't comment on that. I'm not going to make you say no comment, but I do want to know what you took away from your experience in the first Trump administration in a very polarized climate. How did you navigate those waters?
So you are correct. I am running a research lab at the National Institutes of Health working on diabetes and a rare form of aging called progeria. So I am a federal employee, so I'm not going to be able to comment on any particular nominations.
I told you.
But I will say, in the first Trump administration, I was a big part of Operation Warp Speed. That was an amazing achievement that by pulling together the public and the private sectors. And I got to say, a big shout out to Secretary Alex Azar, who was a big part of the way in which that all came together. And in 11 months, we produced this mRNA vaccine that had unprecedented safety and efficacy compared to anything that most of us dared to hope for. So it was a remarkable success of how the government can really work effectively in that situation. And it was all based upon the rule of evidence, that nothing was going to happen, nothing was going to get approved unless there was really rigorous data to show that it was working.
But then once it was approved, that's when the trouble began. How did you had trouble selling it, if you will?
Yeah, and I think there were a number of missteps that happened along the way. People like me who were in the position of being able to try to explain to the public what was happening with COVID were often in a circumstance where we were dealing with incomplete data, and then things changed and you had to change the recommendation, and people began to wonder, wait a minute, why is this happening? Do those people really know what they're talking about? I wish we had been more consistent in saying, this is an evolving situation. We're going to tell you the best information we've got right now, but we might have to change it later when more information comes along. Yeah. But yes, people did begin to wonder whether all this information was true. And then we had social media with a massive amount of really troublesome misinformation, some of it intentional disinformation, that caused people to begin to doubt whether the vaccines really were safe and effective. And the saddest statistic of all of this, and this is Kaiser Family Foundation's analysis, is that between June of 21 and March of 22, on the basis of misinformation that caused people to decide not to trust the vaccines, 234,000 Americans died. Wow. That's like 3 jumbo jets crashing every day for 9 months. And that happened because of misinformation.
I'm going to jump in there because our time is short. And I know that one area where you have found common ground is in promoting a move to eliminate hepatitis C. You've written that you watched your brother-in-law die of the disease, that 2 years later, medical science invented a cure, a simple pill, but it's expensive and people don't have access. And so you are now on the verge, I think, of passing bipartisan legislation.
I hope so.
And you have written that it's both a compassionate plan to expand access, but also deficit reduction. And I am wondering, how do you promote compassionate plans, public health initiatives, and rally bipartisan support when they're not deficit reduction?
That's a lot harder. And I think anybody working in public health recognizes that we do have fiscal problems in our country with deficits that have ballooned into a very large space. But I'm glad you brought up hepatitis C, because everybody, this is a really good story. This is good news. Here's a disease that currently affects 4 million Americans, and it is curable. 1 pill a day, 12 weeks, 95% cure rate, no side effects. But most of those people don't have access because of cost, because of our healthcare system that is not equitable and doesn't reach marginalized communities. You get hepatitis C from contaminated blood. A lot of these are folks who have had an experience with intravenous drug use, maybe doing fine now, but they're infected. And over the course of 20, 25 years, they're going to end up with liver failure. They might need a liver transplant, which costs $1 gazillion. They might get liver cancer. The Congressional Budget Office, just recently looking at the legislation which has been put together by Senators Cassidy and Van Hollen, notice bipartisan, has indicated this will be cost-saving in 10 years if we just introduce it. And I am hopeful that in the course of the next 2.5, 3 weeks, that the momentum behind this will be sufficient that we will be able to get this into the end zone and launch this project next year.
The forever hope for the lame duck congressional session.
Come on.
So I talked to Dr. Dodds about evangelical Christians.
Yes.
And you are
I am.
an evangelical Christian. You've written a whole book about it.
Yes.
I am wondering, what do you think accounts for the loss of trust on the political right and within the Christian community, and what can be done about it?
Well, let's say that it's clear to everybody now that we have an extremely divided society, and that affects people of faith as well as people of no faith. And it didn't just happen overnight. It's been building over the course of 20 or 30 years. And COVID came along at a point where I kind of thought at first, maybe that's going to bring us together. Isn't that what a common enemy is supposed to do? And for maybe the first 3 or 4 months, we were kind of unified, and then we started to not be unified. And now it seems that this drove us even further apart. And people of faith who have had a history of not always being completely comfortable about scientific claims, thinking maybe scientists are all atheists, believe me, we are not, had, I think, an increasingly high level of skepticism about what they were hearing. And frankly, politics, which got into this in a big way, also has gotten into the church in a big way. And a lot of people sitting in the pew on Sunday morning are wondering, hey, what happened to us? Why aren't we talking about loving your neighbor and even loving your enemy instead of all of the animosity that seems to have found its way in there? So people of faith were whipsawed by all of this. Good, honorable people who want to do the right thing. And many of them sort of were influenced by the messages they heard and were a little less likely to think the scientific facts were trustworthy, and here we are.
So, and you, in a very personal way, have tried to bridge the divide with your work through a group called Braver Angels.
Yes.
It's a nonprofit working to kind of depolarize America. I know you were teamed up with Wilk Wilkinson,
Yes.
a trucking manager, and I want to ask you about something you said to him last year that actually has rankled a lot of people in public health. You said that public health people during the pandemic had, quote, made a, quote, really unfortunate mistake by not paying enough attention to the social and economic consequences of the people whose lives you were trying to save. And you said, quote, if you're a public health person, you have this very narrow view of what the right decision is, and that is something that will save a life. Doesn't matter what else happens. And I'm wondering, do you stand by those words? And given that, what advice do you have for your successors?
So, appropriate question. Braver Angels has been a wonderful opportunity to put together people on the red and the blue sides.
You have 17 seconds.
That quote is taken a little out of context. I was being quizzed about how, as part of the COVID response team, I would make decisions. And I said, I took the Hippocratic Oath. For me, saving the life is number one. Other parts of the decision-making process could worry about the economy, and they should, and worry about the schools. But for me, it's how I'm going to keep people from dying, and I'll defend that. But I grant you that that mix of perspectives was not always fully represented, and there were circumstances where schools were closed for too long and businesses were closed for too long. A lot of this we can learn from. But I will say, I think when you look at it, public health, for the most part during COVID, did everything right that they could with the evidence that they had, and those are good, honorable, wonderful people, including a lot of people at NIH. And it is really sad to see them now being scapegoated as they are in some circumstances.
All right, we will have to leave it there. Thank you so much, Dr. Collins.
Thank you, Sheryl.
I'll let you go. And then
Please welcome Ronald J. Daniels, President of Johns Hopkins